Our goal, our role is to help others. And if we're not well, it puts us in a terrible position to do our job.
Physicians are retiring early. Even younger physicians are just leaving medicine altogether, and it's a real problem for our communities.
And so for us to be most effective, we got to take care of ourselves.
This conference is about the 100,000 physicians in California, the over 200,000 nurses, and the over 600,000 healthcare workers in our state, but also the 1 million physicians, the 4 million nurses, and the 10 million healthcare workers across the country. So wellness is important because we often take for granted that the workforce is somehow going to cope or manage the situation themselves, when in reality we know that burnout is caused by systemic problems that often get shouldered by the workforce. So we need to be able to start addressing it, defining it, and then identifying the source of that pain so that we can remove it.
I think we have to take agency of taking care of ourselves and being aware of what's happening. Sometimes we don't know we're going through burnout, and we have to kind of be aware that's what we're going through and really learn about support services and ways we can all make it better together.
I'm not an expert on wellness, but I'm hoping to hear from the leading voices, people who've done research, published, have been in thought discussions about this so that I can learn. I can take that back to my group, take it back to the physicians that I work with.
I really want to connect with people that are in this space and just learn what they're doing individually or organizationally to just really help us combat burnout, whether it's structurally, efficiency-wise, or on the personal level.
The best parts, I thought, were the inspirational speakers that we had. And it's interesting, often they aren't physicians, but they're people who talk about how healthcare made such an impact on their lives.
It was really important for the LA County Medical Association to be involved because LACMA represents physicians regardless of their specialty. 2, it has the unique ability to reach physicians from large organizations as well as solo and small practice physicians who are also experiencing that burnout. Besides that, it's really LACMA's leadership as the largest county society in the state that really will, I think, create a wave across the state itself.
Having a forum where we can all talk about the same topics and share information, because maybe my best practice can make a big difference to someone else, or someone else actually can go like, well, we do it differently. And that's the place that we can actually have that conversation here at LACMA.
But I think the biggest thing that LACMA does that is a passion of mine is advocacy. And LACMA focuses on public health issues which directly affect our patients, both at the county level and at the state level. And I want to be a big supporter of that. And I'm very glad that this is a target, a goal for LACMA. And that's why I'm a member.
Doctors, we're trained to take care of patients one person at a time. But when you start to see this avalanche of patients coming through, you realize there's got to be something upstream that we can fix. Even if we can't do it ourselves, we can at least speak to those who can change those things. So that's why I'm a LACMA member, and I think every physician here in Los Angeles County, if you're a practicing physician in LA County, you really should be a member in LACMA.